Hi, Dr. Giles here. Has your child ever woken up in the middle of the night and started to complain about their ear hurting? Well, ear infections are one of the most common reasons that I see children here in my office. So today, we're going to walk through what causes them, what signs to look out for, and when to come in and see the doctor. So, what is an ear infection? Well, to start out that question, I'm actually going to show you a picture of an ear. The ear has two main parts to it. You've got the outer ear here and the middle ear here. In the outer ear, one of the most common things that we see happen is wax buildup. The other common thing that we see in the outer ear is going to be something called swimmer's ear. This is when the ear canal gets a little inflamed, and that inflammation causes pain and sometimes may even have a little bit of discharge coming from the outside of your ear. So if you're noticing that, please come in, get evaluated, we'll take a look at it. The other area here, the middle ear, this is the most common place where we get the ear infection. When a doctor looks in your ear, this is what they're going to see. For an ear infection, you can see the eardrum. It is red, it's inflamed, it's bulging. What it should look like is like this. You can see this here. The eardrum is nice and clear. You can see the reflection of the light from the otoscope, and you can even see a little bit of those bone structures that help to hold the eardrum in place. So if the ear infection is behind the eardrum, well, what causes that? Well, what usually causes that is it starts out with some sort of virus. And the virus causes congestion, runny nose. What that does is it clogs the tube that lets the middle ear drain. So let's go back to this picture. You see this little tube going off to the side? That little tube drains at the back of the nose and back of the throat area. And so, as we go back with this viral infection, the congestion can swell, it can block that entrance, or it can at least make that entrance smaller, and then the fluid doesn't drain as well. And when fluid stays in the same place, that fluid can allow bacteria to grow. Once bacteria grows, then you get the swelling, the pain, and there comes the infection. So what are these signs of the ear infection? Well, ear infection, you're going to have ear pain. You may also have fever. And then, of course, you're going to have that tugging, pulling at the ears, especially for our younger kids who can't quite explain what is going on. And if the fluid stays long enough, sometimes it can even cause a little bit of difficulty hearing from that ear, just from all that fluid pushing on the eardrum. So your doctor looks in your ear, decides it's an ear infection, then what? Well, at that point, your doctor may decide to prescribe some antibiotics. The most common form of antibiotics is amoxicillin. This is great because it really targets the bacteria that likes to grow in that middle ear area. Now, other ways to treat ear infection is to deal with the pain or the fever. And with that, you can use Tylenol or Motrin. And of course, as with any illness, please drink plenty of fluids. So why is it then that our little kids get ear infections frequently? Well, this actually has to go back to the anatomy of the ear. When you have a small child, that little tube that drains to the back of the nose is much more flat. And because it's flat, when it gets clogged or anything like that, the fluid stays in that area a lot more easily. As you get older, your face actually elongates, turning from more of that circle shape to that oval shape. And as it does, that tube goes from flat and starts to angle downwards just a little bit. That little bit of an angle helps the fluid to drain. And so because the fluid is draining, the ear infection doesn't really happen as often or frequently. So is there a way to prevent ear infections? Well, unfortunately, you can't always prevent an ear infection. And that's because a lot of it comes from those first signs with the cold and blocking off that tube that drains the ear. So to prevent an ear infection, what you want to do is do the same things that you do to prevent a cold. Wash your hands, sneeze or cough into your elbow, disinfect any dirty surfaces. Doing that will help protect your ears. So to wrap up, here's what to remember. If you're having severe ear pain or a fever that's lasting longer than expected, please come in to get evaluated. Your doctor may want to prescribe some antibiotics. And then, of course, if you're ever unsure or you're worried, please come in. We love to see your children. Looking in their ear is one of the funnest things that we get to do. And then, if it's an ear infection, we can help you treat it. Well, that's it for now. Stay healthy, and I'll see you next time.